Okay, welcome everyone to the 2023 NNLM Virtual Symposium on Health Misinformation. We are glad you were able to join us today. My name is Jen Ortiz, and I am the Health Literacy and Membership Specialist for the NNLM Region 3 office. We have just a few technical items to cover before we begin. All attendees have been muted, but we do welcome your questions and any comments in the Zoom chat at any time. VFairs is providing technical assistance today. NNLM staff will be keeping an eye on the chat for me. Please be sure to select everyone from the drop-down menu when posting your comments in chat to ensure everyone sees them. Submit questions for the speakers using the Q&A function to ensure they do not get lost in chat. We have a live closed captioner for this event. You can access the closed captions by clicking on the icon with the 3 dots and then selecting closed caption. If you would like to share on social media, and we highly encourage that, we encourage you to use the hashtag for this event, HealthMisinfo NNLM. And then before we get started, I'd like to share a little bit about who we are. The National Institutes of Health is the nation's leading medical research agency. Many of you might be more familiar with the National Center for Allergies and Infectious Diseases, which is one of the many institutes and centers at NIH. NLM, or the National Library of Medicine, is one of the 27 institutes of health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, the network of the National Library of Medicine, is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. So it is my pleasure today to introduce this afternoon's speakers. We have Urszula Lechtenberg, Rebekah Miller, Beth Hoffman, and Marc Ross. So I will stop sharing my slides. I'll let you get started.
Thank you very much. I will share my screen. Thumbs up from my panelists. Yes, okay, thank you so much. Welcome to our session, Strategies for Dispelling Health Information, Pre-bunking and Motivational Interviewing. Our interdisciplinary group is currently collaborating on a University of Pittsburgh sponsored project entitled Disrupting Health, Dis and Misinformation in the Patient Care Setting, Open Educational Resources for Nurse Education. And that forms the basis of this presentation. Our group approaches this topic with varied expertise, and all 4 presenters have experience in teaching and researching misinformation and or information literacy. And I'd like to introduce us now. Dr. Beth Hoffman is postdoctoral associate in the Department of Behavioral and Community Health Sciences at the Pitt School of Public Health. Beth has extensive experience researching health-related dis and misinformation on social media with a particular focus on vaccines. Marc Ross is head of the Haskell and Hanley Libraries at the University of Pittsburgh regional campuses of Titusville and Bradford. He has experience teaching information literacy classes, including the evaluation of information to nursing students and students in the allied health field. Rebekah Miller is research and instruction librarian at the University of Pittsburgh Health Sciences Library System. Rebekah has taught various classes on health misinformation and information literacy, including a 5-week course for older adults on navigating the current infodemic. She is the library liaison to the University of Pittsburgh School of Nursing. And I am Ulla Lechtenberg, Learning Design Coordinator at the University of Pittsburgh Library System. I have experience teaching sessions to undergraduate and graduate students about evaluating information online, and I have expertise in instructional design, specifically creating online learning materials for various learners. And this project that we're talking about was supported by the Pitt Seat Grant internal funding program at the University of Pittsburgh for the academic year 2022-23. And as an acknowledgement, we'd like to share the names of the rest of our team. I mentioned that we have an interdisciplinary, transdisciplinary team. And so that includes folks from the libraries and the public health and School of Nursing, disinformation lab, and then we have several content experts that we would like to give many thanks to. So here is an outline of our session this afternoon. We'll take you through the background and context of the project before diving into the methods we are teaching through asynchronous modules, which include pre-bunking and motivational interviewing. We'll briefly talk about why this will be an open educational resource before doing a brief demonstration of some of the content that we have so far. And then we'll end on lessons learned before opening up for questions. So I will hand it over to Marc to get us started.
Thank you, Urszula. As Urszula mentioned in her introduction, my name is Marc Ross. I am the head librarian at two of the University of Pittsburgh's regional campuses, Titusville and Bradford. Both are about 2 or 3 hours away from the city of Pittsburgh, so I come with more sort of a rural perspective of this project and how we might work with two-year nursing students that I have on the Titusville campus. So I'm going to talk a little bit about the background of the project, how we really got the ball rolling and how it evolved over the course of a year and a half, 2 years. And then I'll talk a little bit about the context of the project, how we were able to get faculty support, how we were able to then integrate these, or how we will be able to integrate these into the coursework of nursing students going forward. So a little bit about the background of the project. It really started a few years ago in the fall of 2021, just as a small, conversation during my one-on-one meetings with my supervisor, who at the time was in Pittsburgh while I'm in Titusville. So we met, once a week or so virtually, and she'd, talk about what kind of projects I was working on, what issues I was seeing with the students on campus, and how the library can help any of those issues or problems. So around the same time, some background about the Titusville campus. In the fall of 2021, we transitioned away from a 2-year liberal arts university into one that was going to focus on workforce development, just because of the changing demographics of our location and some of the projects that Pitt was working on our campus. So the only program that we maintain at the Titusville campus from the University of Pittsburgh is the nursing program. So in those conversations with my supervisor, we talked about ways to make sure that the library stays relevant during this transition phase at the Titusville campus, and how we might be able to still support the nursing students, the nursing faculty, and the area workforce needs of Northwest Pennsylvania. So during those discussions, what we really stumbled on was that it's difficult for librarians to enter nursing classrooms, especially 2-year nursing classrooms, because of how structured and how regimented the coursework is. It's difficult for us to do multiple sessions, to really scaffold classes rather than just do one-shot sessions. So what we talked about was focusing on some specific things that we might be able to work on the campus, and how we might be able to integrate those either into the classroom or into workshops outside of the classroom in the library space. So what we focused on was translating traditional academic information literacy skills into skills that we thought would be desirable in the workplace. Part of why we chose that as our focus was on top of some of the transitions and changes happening on the Titusville campus. I'm working on my dissertation with the in a doctorate in education program with the University of Pittsburgh, and some of my preliminary research showed that there are some skills gaps in graduating nursing students entering the workforce, and we thought we might be able to fill some of the gaps that we found in the literature using some of these workshops. So they initially focused on communication skills and ethical social media use. The research I was doing, some of the literature reviews we were reading, noted that as students graduated and entered the workforce, there were some communication skills that could be built both between the newly graduating nurse with their peers and their colleagues, but also with their doctors or any other supervisors, as well as patients that they interact with in a clinical setting. So we thought that was a good place to start. And then we also wanted to talk about ethical social media use. This was during, the height of the pandemic. And we wanted to make sure that students understood that if they were posting on social media, they have to be aware that their posts could be read by future employers or future schools if they wanted to go on to get their BSN or graduate further education. So we thought a lot about ethical social media use and the spread of mis and disinformation on social media and how that might impact students. During these discussions, we noticed, and as we were reading, we thought we wanted to bring in Rebekah from the Health Science Library, so she'll talk a little bit more about what she's done since. But we initially started as just kind of a literature review. We were going to write for a journal, seeing how librarians were focusing on stopping the spread of disinformation during the pandemic. During our research, this early stage of the research, we noticed that everybody, including ourselves, noted that it's difficult for librarians, single-handedly to stop the spread of dis and misinformation. So around the spring of 2022, Rebekah, myself, and Rachel Rubin, my previous supervisor, we decided we should bring in some additional stakeholders and really start evolving the conversation. I think that's when Urszula joined the initial conversations as well, to really get that multidisciplinary team built and really focus on a single issue, which is mis and disinformation. So again, like Urszula said during the introduction, we brought in librarians from the Health Science Library System. We brought in experts from the Pitt Disinformation Lab who talked to us about how disinformation spreads in communities and through social media and other means. We brought in faculty from the Pitt School of Nursing to really get their support and understand where they might be seeing issues with the spread of disinformation and how we might be able to help with that. And then we brought in members of the University Center for Teaching and Learning who helped us develop learning outcomes, develop some of the skills that we're going to talk about today, and then also help write some scripts with Urszula and Rebekah specifically. So what we focused on for these modules and these initial projects that we're working on and going to talk about today was to teach nursing students how to identify mis and disinformation, both on social media, amongst their peers and colleagues, and then also in a clinical setting with their patients. And then we also wanted to give them tools and show them some tools necessary to identify that mis and disinformation, and some tools and interventions that could help disrupt the spread of mis and disinformation. Urszula, can you go to the next slide? And then the context of the project, how we were able to get some support and why we thought this was a good area and place for this project to live. Around the same time that this project started up and running in 2021, AACN, the American Association of Colleges of Nursing, updated their essentials. We thought this would be a really great opportunity for us as a multidisciplinary team to really pour over those updated essentials, find areas where we thought the helping to stop the spread of and identification of mis and disinformation would really fit. So it was a really great timing both for this to line up. The nursing curriculum was also changing at the University of Pittsburgh to match up with the new competencies and the new nursing essentials. As those of us that were poring over the essentials started looking at how the nursing curriculum was also adapting towards those essentials, we noticed that there was little to no information in the curriculum to talk about mis and disinformation. So again, we thought that was a good place that we could help line up. So with all that and working with the nursing faculty and all of our whole team, we developed interventions that will be specifically for sophomore nursing students on the Pittsburgh campus. However, we created the learning outcomes to mirror nursing competencies so they can really be used by any nursing program. And that's why we chose to go with an open educational resource, which will be discussed later. These projects, modules will be integrated into the nursing research class on 2 campuses in the fall of 2023 and spring of 2024 as homework assignments, and they will have a corresponding in-class activity. They will live and be hosted in Canvas, which is the University of Pittsburgh's learning management system. And I'm going to pass on to Rebekah to talk a little bit about the methods and structure.
Right, thank you. So we are creating 3 interactive modules. So these are being created in the Storyline software. And like Marc said, they're going to be hosted in Canvas. There are 3 modules. The first is a basic introduction to misinformation. So, what it is, what are the issues that we want students to be aware of. And then also we're going to teach them the SIFT method of fact checking so that they can understand how to figure out if something is or isn't misinformation. And then our other 2 modules are going to be the interventions that we're teaching students to be able to use with their patients or even their colleagues. So the second is pre-bunking, and then the third is motivational interviewing. So we're going to go a little bit more in depth into what pre-bunking and motivational interviewing entail, but essentially pre-bunking is for people who haven't really been exposed yet to misinformation, or possibly they've been exposed but don't believe it. And then motivational interviewing is for people who have been exposed to misinformation and they believe it, and they're also either they've made a health decision or they are on the verge of making a decision based on that misinformation. So these modules, initially we thought they would be about 20 minutes. They've gone a little longer. We think they might be a half an hour each towards the end of this. But they're going to be a combination of informative text. There are quick assessments, so multiple choice and things like that. And then they also have these choose your own adventure style videos. So we wrote some scripts, we hired some actors, and we created these scenarios so that basically what happens is students can decide what the nurse is going to say to a patient. So there's some sort of misinformation scenario happening, and the student chooses what the nurse says and then gets to see the patient's reaction to what they say. And it kind of can go from there. So we're really hoping to give the students practice in some of these skills and seeing, what are the consequences if you say one thing versus another. So again, our 2 methods that we're really focusing in on are pre-bunking and motivational interviewing. And I'm going to talk a little bit more about pre-bunking. Okay, so pre-bunking is basically providing accurate information as well as an understanding of how and why disinformation works. And ideally, this is before someone actually sees the dis or misinformation. So the idea is that you're kind of inoculating someone, and hopefully that if you catch them before they see disinformation, they'll recognize it as being untrue, and so they're going to just reject it outright. So we do know that, some misinformation exposure is, of course, going to be inevitable. So we are teaching the students that the key is really to ensure that you're pre-bunking someone before they believe misinformation. So even if they've possibly been exposed to something, pre-bunking may still work. So the goal here is really to reduce the likelihood of someone believing misinformation because they understand the underlying tactics that are being used, so they can kind of see through the manipulation and then again reject it because they can see that it's misinformation. So we're ideally providing the tools to dismantle the disinformation by kind of showing how it works. So research has actually shown that pre-bunking is more effective than debunking. So debunking is fact checking after someone has already seen something. And the problem with debunking is it still might potentially stick in your head, right? We can still remember things even if we know it's not true. So the idea with pre-bunking is hopefully having people's guard up against something will help it bounce off and they won't remember it as well, and it can kind of protect them. So for teaching pre-bunking, there are 3 types of pre-bunks, and this comes from First Draft News who have a really good outline of how to do pre-bunking. But the first is fact-based. So basically you expose a piece of misinformation as not being true, and you give the person a lot of good information, right? So you tell them, oh, this isn't true, but here's what is true. The second is logic-based, which is when you are exposing tactics and the narratives that we keep seeing again and again being used in disinformation. So a lot of these tactics are recycled. So you just expose, this is what you might see. So be on the lookout for this. And then the third is source-based. So source-based is when you are exposing specific sources of disinformation. So, oh, we know that this website has bad information, or this is a website that has an anti-vaccination agenda, something like that. So people know not to trust information from that specific source. So in our module, we are only teaching the logic-based strategy. And there are a few reasons for that. I think that we thought that this would be the most effective for our students in this specific asynchronous module type of delivery. And then we're also thinking that we are sort of covering fact-based and source-based in the module 1 because we're teaching SEPT. So students will be able to understand how to check sources. They'll be able to understand how to check facts. So we're hoping that will be a little bit covered. But again, we're only doing logic-based for our module. Okay, so how are we teaching these disinformation tactics? We are using a combination of real life examples that we've pulled from social media, and we are also have a made up scenario. So we didn't want too many real life examples. We didn't want to be exposing people to misinformation they may not have already seen. So we created a scenario for our students. And then we picked a handful of common disinformation tactics to teach them. So for example, we have fake experts. So again, people who are purporting to have some sort of expertise that they don't really have. We are going to teach them about emotionally charged language, so fear mongering, or even feeling this validation because of something. Scapegoating, so when you are blaming a group of people for something that is definitely nothing to do with them. And then ad hominem attacks. So when you are attacking an individual person as opposed to their arguments or ideas. And then conspiratorial thinking, which is this belief that there's some sort of shadowy group that is pulling the strings and causing things to happen. So those are the 5 tactics that we're focusing on for this module. And you can see on our slide here, some of our, these are our fake social media examples. So again, we created a scenario where there is a disease outbreak. It's kind of like a combination of COVID and measles and a whole bunch of different things. But this first post here is an Instagram post from someone called Chris Truth. And part of the post says, Big Pharma and the CDC don't want you to know about all the healthy people dropping dead after taking this vaccine that we made up. So this is an example of emotionally charged language. This is some fear mongering here. And it's also an example of conspiratorial thinking, right? Then up in the upper corner, we have a Facebook post from Stacy, and our scenario, it started in Pennsylvania, the outbreak. So we have Stacy saying, everyone knows Pennsylvanians are dirty and disgusting. So she is scapegoating the people of Pennsylvania. And then we also have a Twitter post from Dr. Ray, who is our made-up expert in this scenario, where she is an example of good information. So we want students to understand that not everything that they see is fake. They're, of course, purveyors of good information. So we have some examples of good information as well. And then the last thing that we do is we also discuss some of the motivations for spreading disinformation, just very briefly, so students kind of get an idea of why people might spread it. So the one thing that we do have to do too before students can pre-bunk is we have to get them prepared. So to prepare them for pre-bunking, we cover how do they keep up on these topics. So we have some suggestions for them. We suggest that they consider their patient population. So, are there patients likely to be targets of particular disinformation campaigns? So we know that some disinformation actors target especially marginalized communities or just specific groups potentially. So we talk to them about that and ask them to think about, who their patients are. We tell them to pay attention to just what's going on around them. So the news, social media, and maybe what their colleagues are talking about. We tell them to be aware, but we stress that they don't have to be online all of the time. This is just something to keep in mind when they are. And then we tell them they may want to periodically check fact-checking sites. So we give them a few sites that they might find really helpful, like healthfeedback.org is a great site that has actual social media posts that it talks about, whether the information on it is true. It has news sites that it looks at too. So we give them a few different sources that we think are helpful for them. So when we talk about pre-bunking for nurses, we talk about pre-bunking as kind of a type of preventative care. So we guide, again, students how to assess the rumors. who they should pre-bunk and then how they should pre-bunk. So the who they should pre-bunk is really important. We don't want them pre-bunking everyone about everything. That's not effective. We have a few videos that demonstrate, pre-bunking someone about something that is totally not relevant to them and how confusing that can be for people. So we really stress that pre-bunks have to be relevant to the patient, but also the care they're receiving that day. So this was really important to our nurse colleagues that, it has to be related to the care. And then we also include an interprofessional component. So that's important to our school nursing, and it's also important to the AACN Essentials. So we talk to the students about how they can work with colleagues to pre-bunk their patients, but also how they may want to pre-bunk their colleagues. And now I'm going to turn it over to Beth.
Thank you so much. So I'm going to talk a little bit about our second method, motivational interviewing. And as discussed a few minutes ago, motivational interviewing, we're teaching it in the context of using it when interacting with patients and colleagues who have already been exposed to the mis or disinformation. They may believe it and are also about to make a health decision or maybe making a health decision based on that mis and disinformation. So a quick overview of motivational interviewing. Some of you may have heard about it in the context of substance use, which is where it's often talked about in terms of behavior change around use of substances or smoking, but it can be used for any topic, including behavior related to mis and disinformation, such as acceptance of or not acceptance of vaccines, use of sunscreen, and other topics. Motivational interviewing is a collaborative, person-centered conversation style characterized by acceptance, empathy, and unconditional positive regard. And one of the keys of motivational interviewing is to use a guiding style, which asks the patient, how can we work together, instead of telling the person what they should do or what they should believe. And telling someone what they should do or trying to fix the problem for them is what's known as the righting reflex, which is to be avoided in motivational interviewing. And we talk about how many of us, I'm sure, in our own lives are familiar with this. You have a loved one who is maybe doing something that is harmful to their health or you don't agree with, and there's an urge to come in and fix it. And that's often true as well in a professional setting. But what motivational interviewing really stresses is that people often know what is right for them, or they're really their own best experts. And so the role of the health professional, in this case, nurses, is really to help guide a person toward behavior change. Next slide, please. And motivational interviewing uses the OARS acronym to teach people how to use a guiding style. So OARS stands for open-ended questions, affirmations, reflections, and summaries. And I'm going to walk through what that might look like in the context of a parent or a pregnant person who is concerned about having their child receive the polio vaccine, which is one of the scenarios we used in our videos. So sometimes we see that people are concerned about having their child receive the polio vaccine because of misinformation that builds off of the kernel of truth that the Sabin or oral polio vaccine in rare instances can cause vaccine-derived poliomyelitis, which we've then seen travel on social media as the polio vaccine causes polio. So in this context, if you have someone who's expressing concerns about the polio vaccine, an open-ended question would be to say, well, what are some things you've read about the polio vaccine? And the person may express that they've seen posts or they've seen content or heard loved ones talking about how the polio vaccine can cause polio. And so after hearing them express this, an affirmation, which in this case is really affirming what the person is doing that is a positive. In this case, it could be saying, I can tell that you care a lot about the health of your child because this person has put a lot of effort into researching the vaccines that their child would be receiving. Next is reflection. So reflecting on what you hear or you think you are hearing. And this offers an opportunity to make sure that there's no misunderstandings and really forces the provider to practice active listening skills. So in this case, a reflection could be, it sounds like you've heard some scary things about the vaccine. And finally, the use of summaries. And this is similar to reflections, but the idea here is to summarize not only what you've heard, but also what the person is expressing, maybe in other things they've said to you, in a way that guides them towards change talk. So using that guiding style. And in this case, an example of a summary is you're unsure about the safety of the polio vaccine, and at the same time, you feel confident about the recommendations of other vaccines for your child. And this summary helps to set the stage for the person to maybe realize that there's a little bit of contradiction here in that they're trusting the nurse, they're trusting their healthcare provider with recommendations around other vaccines aside from polio. And hopefully in doing this is helping to guide them toward accepting the evidence-based recommendation. Next slide, please. So again, what this looks like for our modules and in motivational interviewing for nurses is teaching that motivational interviewing can be used when a patient or colleague is engaging in behavior that could be stemming from exposure to mis or disinformation. So in other words, it's sort of too late for that pre-bunk. We also guide students through how to engage patients and colleagues with empathy, with asking open-ended questions, using the ORS framework, as I mentioned, and providing accurate information if appropriate. In the latter, we encourage use of the elicit, provide, elicit framework, which is first eliciting from the patient or colleague what they already know, and also eliciting by saying, is it okay if I provide you with some information that I know? So in that, eliciting permission to then provide this information. And then finally, eliciting what their thoughts are on the factual information that's been provided. We also in our modules encourage both the verbal communication as well as emphasizing that a big part of motivational interviewing is nonverbal communication. And then finally, stressing that behavior change is unlikely to occur that same day, and motivational interviewing as a process and really involves relationship building.
So we would like to show you a little bit of what this will look like when students are going to engage with these modules. So we have a demo of our pre-bunking module specifically. So I'm going to switch my windows here. And as Rebekah mentioned, this is being built in Articulate Storyline. So it has kind of this like slide deck, PowerPoint view. And I'll just kind of set this up a little bit for you because I'm going to have some of our videos play. So we have this choose your own adventure case studies where we wrote scripts, we filmed actors acting them out, of course, and then students get to see all of these videos in chunks and make decisions based on those interactions. So the first video that you're going to see is kind of the setting of the stage. So when two colleagues, a nurse and a resident, kind of talk about what they've been hearing on social media about a certain topic.
Hey, Ben. Hey. So I wanted to give you a heads up. I've been getting a lot of patients recently asking about vaccines and their safety. So I went online and found this viral video from this mommy vlogger, and she's talking about childhood vaccines and how they're being blamed for a whole bunch of conditions and things like that. And there's a comment on that video about the government microchipping vaccines, and another one about vaccines mutating your kid's DNA. And then there's all this talk about natural immunity being stronger than vaccines. So, but anyway, forewarned is forearmed, right?
So we're at the first decision point for the student. They are put in the situation, they've just, witnessed this encounter, learned about this misinformation, and they are going to potentially see these 3 patients today. And so their first decision is who should they pre-bunk about the topic of childhood vaccinations. So the options here are a male patient, 62 years old, no children, female patient, 27, no children, has current IUD, and a female patient, 26, no children, but is in the 3rd trimester of their pregnancy. So just to show you the incorrect answer, I'll pick the male patient first.
And I just wanted to take a minute to talk to you about early childhood vaccination. Now, there are a lot of scary things online suggesting it's not safe, but all the research shows that vaccinating children at a young age is safer than not vaccinating them.
Huh? Why are you telling me this?
And then we have feedback on why that answer is incorrect. So the correct answer here is the female patient who is in her 3rd trimester of pregnancy. We'll have more, since this is just a demo, we'll have more feedback as to why this is the correct answer. But now the student can decide how the nurse will continue the pre-bunking conversation with this relevant patient, right? So we have the nurse in each video saying something about childhood vaccinations in different ways, and then the student can choose what is the best way to start this conversation. So again, I'll show you maybe not the best way first.
Okay, now, you're going to be vaccinating your child soon, so here is the pamphlet. Make sure you follow the schedule. Don't believe the things you see online, they're stupid. Vaccines are safe and you need to get them, okay? I can't get over some of the lack of good sense that people have. I mean, your kid gets the mumps, that's on you, and that's their fault for being stupid.
So then the student would watch the other 2 videos, and I believe the correct answer is this one.
Okay, looks like we've handled all of that. And you're in your last trimester, so something we like to talk to expecting parents about is vaccinations. So here is a pamphlet of the standard vaccination schedule from newborn into childhood. We also recommend that pregnant people get a Tdap vaccine against whooping cough and a flu shot during the 3rd trimester.
So in an interest to show you sort of the feedback, if it's the incorrect answer, they get to see the entire interaction with the patient. So we have our pregnant patient here.
Okay, now, you're going to be vaccinating your child soon, so here is the pamphlet. Make sure you follow the schedule. Don't believe the things you see online, they're stupid. Vaccines are safe and you need to get them, okay? I can't get over some of the lack of good sense that people have. I mean, your kid gets the mumps, that's on you, and that's their fault for being stupid.
I haven't decided yet whether to vaccinate my baby. And are you calling me stupid? My cousin didn't vaccinate any of her kids and they're happy and healthy. This is my choice. You leave me alone.
And again, feedback for why that is maybe not the best way to start the conversation. So the pre-bunking module will take students through an entire pre-bunking conversation with a patient and also a colleague. So we have kind of both perspectives as a healthcare provider, but also as an sort of the example of interprofessional competencies from the nursing essentials. So now I'll talk about open educational resources, OERs, and what they are and why we decided to create these modules as OERs. So the plan is to have these modules be used by the Pitt School of Nursing, but we will also make them available to anyone to use as an open educational resource. So if you're unfamiliar with OERs, they are any type of educational material freely available for teachers and students to use, adapt, share, and reuse. So, maybe the question is why OER and aren't sort of short answer is why not? There are many reasons to have made this project, the end result available to everybody else. Mainly, as we all know, disinformation is a huge problem, especially with health-related information. And every nursing student, health professional should have these skills for interacting with patients, colleagues, and to help themselves to deal with new information. These are widely applicable because we map them to the learning objectives to the AACN essentials. So we hope that along with the School of Nursing here at the University of Pittsburgh, it can be relevant to any nursing program around, or at least within the United States. And the asynchronous modules can then be embedded into any course. And we're planning also to include like a teaching toolkit with these modules on how to use them within the course, and then how to follow up if there are instructors who would like to not only assign this as like a homework assignment, these modules, but do some practice in class or have a discussion or what have you. And so our license for this is, our Creative Commons license is CC by NCSA. So anyone can use it as long as they credit us. Whatever they do with it is non-commercial, so they're not making money off of it. And then whatever you do with it, it also has to have the same license, share alike. So we want every iteration to be accessible to everybody. And if you're interested in knowing when these modules are going to be available as OERs, I have a QR code here, and let me also, but I don't know if I'll be able to put this in the chat. I'm sending you a link, which is just a like if you use a QR code, that's fine. This link is just a short link to go to the same form, and it's just like a mailing list. So we're collecting email addresses, and once we are done with the project and it's available, we want to just send out hey, it's available, have at it sort of email. So it's not like we're going to do anything with that information. I can always go back to this, but I do see that the URL is now in the chat, so thank you very much. And sort of as a way to wrap up the presentation before we open up for questions, reflection, lessons learned on this project so far. We still have a little bit of time left to go in creating the materials. Something that our team has discussed is how every aspect of health information is touched by mis and disinformation, and this made the topic very ripe for a project like this, but it also made it pretty difficult to choose what to focus on in terms of the examples that we used in the module specifically. So we have a variety of topics that we cover. You saw the childhood vaccinations. We have videos about vaping. And did I miss it? There's one more thing.
Sunscreen.
Sunscreen. Yes, sunscreen. That's right. Thank you. And sunscreen usage. So, not everything being vaccine related, but kind of just the wide swath of mis and disinformation around health topics. So some lessons learned in terms of making the videos is writing scripts is really hard when you don't have any background in it. Us constantly questioning whether people sound like that when they say things. But related to that was the importance of our experts, particularly the motivational interviewing experts that we've used, because, and I think Beth mentioned this earlier, it's not only the way that you talk, but it's also your body language and making sure that that is reflected in the verb, like the audio, but also the way that the actors were. And then we also had our nurse expert on site during the filming portion to give us guidance and like just to help the actors act like nurses do. And then in deciding on that content, again, the experts were very, very key. And that transdisciplinary team that everyone was talking about and that we illustrated with our acknowledgement slide, everyone had something important to add. And as Marc mentioned before, it's not just the librarians who are going to help solve this problem. It's going to have to be a lot like a group of people. The scoping was a problem in terms of the content to include. That's part of the reason why our 20-minute modules are probably not going to be 20 minutes anymore. But hopefully we'll still have it, we'll definitely still have it contained. And something that I think all struggled with was the need to flatten that nuance because of the modality of this as an asynchronous module. And especially with the pre-bunking and motivational interviewing kind of going towards the spirit rather than the exact letter of the approach. So Rebekah mentioning that we focused on the logic-based pre-bunking and Beth mentioning the ORS method specifically, but there are nuances to both of those things that we just couldn't include here. And then trying to prevent inadvertent spreading of misinformation. So that's why we made up a lot of our own scenarios so that maybe they were like ripped from the headlines, but they weren't exactly what people kind of understood. Anything else from the team about lessons learned? Just want to, before we open up. Okay. So thank you, everyone. We do have our references here, and we can make sure that these slides are accessible, you can access them after the presentation. But we're happy to answer questions and have a discussion.
Okay, thank you so much. So everyone, if you have any questions, please put them into the chat. We have a few minutes. And I just wanted to say you did a great job on the pre-bunking modules because seeing, you read like, oh, okay, maybe that's not the proper approach or the proper person. But then you actually get to watch the awkward conversation and see how it goes if you don't choose the proper audience or the right way to frame the conversation. So I think that was excellent.
Thank you.
And then so we have a couple of thanks in the Q&A. We have a nursing librarian who's very excited about this, wants to thank you, thinks it's great. Someone else wanted to thank you for making it OER and to let you know, to be sure to announce it on the different MLA caucuses and other places when it's available, because people want to use this. And so as we have other questions come in, we do have one question. How do you teach the students to consider their patient population who are high risk for misinformation without discriminating? Is there a way to do this applying a universal precautions lens or using teach back to first establish their beliefs?
This is a really good question, and it is something that we struggled with. We talk a lot in the modules about intersectionality and about how a person's not a monolith, right? Like everyone has lots of identities. We have a little video we created about this information ecosystem idea, meaning that everyone gets information from all over. And so you can't just assume that you don't know what information they're encountering. You cannot make any assumptions. One thing that's really wonderful about nursing is that it's patient autonomy is like the most important thing. And they are already, well-versed in caring and empathy. So I think it's us saying, you have to talk to your patient and understand where they're coming from is really, hopefully this is going to be not anything different than what they're already hearing. And so that's that we're trying to make sure that students don't just make any assumptions about their patients. So our pre-bunking tends to be based on their care, right? So it's kind of like, well, if this is relevant to their care, that's when you pre-bunk. I don't know if anyone has anything to add to that.
I'll just add one thing to that, which I think this is a great question. And I think one of the things we also struggled with related to this question is these modules, they're not just for right now. Ideally, they will last for many years. And so different, right now we've seen targeted disinformation to certain population segments, but 5 years from now, that could be changing to different population segments. So we thought of it more like, how do we teach these principles around, sort of in the same way that you screen certain populations for different types of behaviors, there's evidence base around that, of how do you apply this more broadly in terms of that screening for information environments, recognizing that information environments and people who are sort of at risk is not necessarily going to hold static over the next 5-10 years.
Yeah, and I'll just, the one thought that I had is when we discussed this, it was like, we could make a whole nother module about this topic specifically. And so, maybe future iterations, or if anyone wants to build on it, you can.
Hey, excellent. And I know you're still building them, so they haven't gone live yet, but have you gotten any feedback from the students about this?
We're doing focus groups with them this summer, hopefully. So we will have feedback from them, but we don't yet.
And part of our project has been to kind of assess confidence levels. So I know we had a group do, like, this is our control group, right? So they haven't seen them. They answered some questions about their feelings, attitudes, confidence level of doing this, having these conversations. And then after we implement these interventions, then we will see if the confidence level grows and attitudes change.
And what is the benefit of mapping the OERs to ACCN essentials? Can you talk more about that?
So for us, the essentials are basically what the nursing school bases their curriculum on. They're like the core competencies for these nurse education programs. So for us to map our learning objectives to the essentials, the School of Nursing can then report that they are meeting these essentials in their curriculum. So by putting this module in the curriculum, we are helping them to meet their essentials that they have to report on.
And I think, making it an OER where we were thinking like, well, if our program is doing that, maybe other programs are also doing that. And then that makes it easier to kind of like plug and play. And it, there's like, because I know like nursing programs are very tightly run. So if you can like make it easy to incorporate, then it will work out better for everybody.
Okay, excellent. So we've got a couple of minutes left, and here are a couple of questions. I'm going to throw them all at you. Answer what you can in the next couple of minutes. So it's, how long did it take to create the videos? What was the cost in terms of finances and human resources to create them? Like how much time? And then how would the videos look different if your marginalized population was rural residents?
This has been a very time-consuming project. And it was really only made possible because of this internal funding that we received. In terms of writing the scripts, casting, and then shooting was only 2 days. Casting took us maybe like a few days to do. Scripts took us a lot longer, but we were also on a tight deadline, so that's kind of all we did for maybe like 2 weeks. And Rebekah is like our PI essentially on this project, so she has been doing like 3 times more work with everybody else. So yeah, it's been it's like so exciting, but it has been a lot. But we're almost there, and I'm really excited to see it like live.
And for the rural, I think we're still trying to figure that out. I'm sort of that voice. We have an opportunity. This was internally funded by the University of Pittsburgh. We have an opportunity for additional funds, I believe, or we could try to figure out something else to roll these into other projects and programs. But kind of goes back to the previous question about how different populations are targeted, or how different populations view their health information ecosystem. I do think in my area in Northwest PA and North Central PA, it is a little bit different than the city of Pittsburgh, just in different ways. We also have a higher indigenous population in North Central PA. So there's, that, health information ecosystem plays into that. So I think that's an ongoing conversation that we're going to continue after, how to deploy this sort of thing. Even though it's an OER, we also want to make sure that we're focusing on the Pitt students that we work primarily with. So work with the regional campuses going forward. So not a great answer, but we're talking about it still. Rebekah, I don't know if you have anything else about that.
Just that I think the hope is to make these universal enough that you can apply what the modules are trying to teach for any population. So hopefully we are successful in that. That's the goal, but these are definitely conversations that we keep having. So.
Okay, thank you. And I think we have time for one last question, and you're getting a lot of positive feedback. Everyone loves the modules. But after the modules have deployed, have you thought of a way to measure the impact on patient decision-making?
I don't think we have.
We have either. That's such a good question.
That would be amazing. I don't know how we would do that.
Well, perhaps you can come back to next year's symposium and give us some feedback on that. But I want to thank you again. This was an excellent presentation. We've got a few last minutes, or a few last things to discuss on my end. But yes, thank you all so much for attending this presentation, and thank you to the presenters. You did an amazing job, and even though I'm not a nursing student, I'm like, oh, I want to watch these modules. So thank you very much. If you're interested in claiming MLA CE credit for this session and others, you will receive an email after the symposium ends, so at the end of tomorrow, with a questionnaire and instructions to claim CE. We have about 30 minutes until our next session at 3 p.m. Eastern. So we encourage you to visit the booths in the VFAIR's website. There's also a photo booth. So feel free to do that. Maybe step away from your computer, get some water, maybe go outside if the weather's nice in your area, and come back at 3 p.m. And then I also want to encourage you to join the network. The membership is organizational, not individual, and it offers benefits such as funding opportunities and resources. And if you would like to continue exploring health misinformation, please join NNLM at upcoming sessions of our Health Misinformation webinar series. This series features presentations from expert guest speakers and will enable librarians, public health professionals, health educators, and healthcare providers to explore various aspects of health misinformation, disinformation, and malinformation, and learn practical and evidence-based solutions for how to identify it and help curb its spread. These presentations will be scheduled intermittently throughout the year, and so you can also sign up for them on the NNLM training calendar. And again, thank you very much to our presenters and to all of you who are attending today.